Hello and welcome to your Medicare Monday, but it's Tuesday because we had the fourth holiday. Anyway, in today's video, I want to talk a little bit about Medicare Advantage versus Medicare. I came across a few articles that I kind of thought were interesting and also a good analogy or simile to kind of basic needs. So, as you know, we all got to eat, right? And what we eat kind of determines a lot of things. But what we choose is a personal kind of endeavor, right? So, give you a really good example. I myself like to go to this place called Texas Roadhouse. Great steaks, great catfish, great sides. But they don't have something that I really love, which is white rice. They have rice and beans, but I don't really like that. I like white rice like how you would eat it in Hawaii. And I eat my steak with that. I eat my catfish with that. I eat my ribs with that. Everything. But they don't have it in the store. Quite a conundrum, right? But I gotta eat. So what should I do, right? Should I order takeout? Should I order the steak? Should I order the catfish? Should I order the ribs? When I go to the store, or when I go to Texas Roadhouse, really I can only get one. There's no point in getting multiple because I can't finish it all. Think about that. When you go to the restaurant, when you go to the store, you really have one choice. You can't really be buying multiple meals to eat at one time. And if we look at the annual enrollment period, that's our one time. It might be a whole year, but it's our one time to make a decision on Medicare Advantage or our drug plan. And depending on what we choose, it really is dependent on us because we can get the steak. Tastes great. I'm a meat eater. I love eating steak. But steak's expensive. It's also not good for our health, depending on who you read, right? And it can make you feel full afterwards, like heavy. It's a problem. It's expensive, right? I also like catfish. I love catfish. Deep fried catfish in corn because it's gluten free. I can't have wheat, remember? And it's cheaper. It's probably, I'd say, 40% less than what the steak costs for roughly the same amount of food. I like that too. But I can't get both because getting a little bit of both is not an option in this scenario of Texas Roadhouse, me eating there, alone for dinner, let's say. What do I choose? From a server's perspective, which is what I am, in relation back to the Medicare Advantage, Medicare Part D plans, I'm the server. I can tell you which one I would prefer personally. I like to eat catfish if I'm looking to save some money. If I'm looking to kind of go out all at it and get that steak, live with the consequences, that's the route I'm going. That's what I would say. In Medicare Advantage or Medicare Part D plans and original Medicare, you're kind of given this choice. And the reason why I equate it to food is because we have to eat, right? We have to eat. We also have to pick a health plan. We can't choose to do nothing. I guess you could, but you'd be hit with all kind of penalties, and in the case of food, you would starve. You could die. But what then should we do? And why am I even talking about this? Well, it's because many people, I feel, when they choose a plan, they feel like I'm shoving these things down their throat. I'm not forcing you to eat anything. I'm telling you, this is the menu. This is what you have to choose from. But the menu isn't the whole story. The steak is $30. The catfish is $15. Are you going to get more out of the steak? 2 times more out of the steak than you will out of the catfish? I don't know. It's really personal preference and how you enjoy things. I might find a day where the catfish I'm craving is going to satisfy me more than the steak is. If I like my stepson there who doesn't eat fish, no way would he eat the catfish, right? He'd choose the steak 10 out of 10 times. He'd choose the steak even if he didn't have a choice of the steak, right? So then where does this tie back into Medicare and choosing and everything? Well, let's take a look at, I found these 4 sites that weigh the pros and cons of Medicare Advantage. One of them is even my site, and we're going to start there. Well, not really my site, the corporate entity that kind of governs some of my Medicare contracts. That's what they say. So one of the good things of Medicare Advantage is more coverage, can be less expensive. They have a Part D drug plan included. And what does that mean? Well, more coverage means that they cover more different services. So most Medicare Advantage plans offer things like gym benefits, dental benefits, vision benefits, hearing aid coverage. They also offer some things like meal services if you get out of the hospital, things of that nature, right? In addition, you could be paying less because when you're on original Medicare and you have to pay for that Part B deductible, you're paying 100% of the costs for medical services received outside of the hospital, outpatient services. Most Medicare Advantage plans offer you first dollar coverage. So you go to the doctor, first of the year, you owe a copay. Could be $5, could be no dollars, depending on the plan you pick. And that's how they lower costs. In addition, most Medicare Advantage plans have a built-in Part D drug plan, which comes at no additional cost, could be free, right? Could be, well, not free, could be added with no additional cost. Your plan could be zero. The Part D plan could be zero as well, right? So it could be such is that this plan doesn't cost you anything, right? Part D is included, low cost when you go to the doctor, and more coverage, so to speak, services wise. All right. Well, what are then the cons of a Medicare Advantage plan? Unfortunately, this little article doesn't talk about the cons. It only talks about the pros of each. Here, where is it? There we go. The cons are located here. MA plans are region-based, county-based, typically. Even within a large state like Hawaii, which is not large at all, there are plans for each different island. Some islands have a plan that only works in that one island. In addition to that, it's really difficult to compare these plans, right? They differ across the nation. They offer different types of benefits. So how do you compare a plan that has no additional dental to a plan that has additional dental? How do you compare a plan that has a 15% coinsurance versus a 10% coinsurance when the individual negotiated rate of the plan is different for the service? I'll give you an example. The service could cost the plan $300 for the 15% plan. Thus, that 15% coinsurance, you would have to pay 15% of $300, right? But with the 10% coinsurance plan, their negotiated rate is $500. So you're paying 10% of $500 now. So in actuality, the 15% coinsurance plan would actually have saved you money in this instance, even though notionally it looks like you'd be better off with the 10% coinsurance, because each individual plan has its own individual negotiated per service rate. So you don't know. And that differs by state, county, right? You have no idea. Also, HMOs, you need a referral to see a doctor. Original Medicare, you don't. And lastly, the plans change every year. So that can be a con as well. So what are the pros then of Medicare, original Medicare? Well, you can accept any doctor that accepts Medicare assignment. Now you might think, well, how many doctors actually accept Medicare assignment? Glad you asked. So 97% of all physicians are participating providers, which means they accept original Medicare. About 0.4% of those do not accept Medicare's assignment, which means that they can charge excess charges. So it's a very small subset. So if you're thinking about excess charges, don't worry too much about it. Opt-out providers Well, the opt-out providers are providers who don't accept Medicare, period. They won't accept typically the Medicare Advantage plan either, unless you're in like a closed system like a Kaiser or one of those kind of more community and county-based HMOs. And that's typically a small amount. And you're going to look here, and most of those folks who do not accept Medicare are going to be in the top here: psychiatry, neuropsychiatry, plastic surgery, neurology, as the top 3. So most physicians accept original Medicare. So that's quite a lot. That's a lot of. It's a big pro, right? Seeing you can, from Medicare Advantage, you have a limited network versus original Medicare, which you have a really huge unlimited. Well, it's not unlimited, but a much bigger nationwide network. Services are covered all throughout the U.S., right? No matter where you are in the U.S., as long as that provider is participating in Medicare, you can see them. And you can see them without a referral. There's no referral. One thing that many articles don't talk about, and let me just double check to make sure this article doesn't talk about it either. Yeah. They don't. Of course they don't. No one thinks about that. So I'm here. All right. So, number one benefit of Medicare, original Medicare, not the Medicare Advantage stuff, is prior authorization. The original Medicare program has very few prior authorization items. Prior authorization typically means that you need to talk to your insurance company before the service is covered. I'm sure many of you have gone through that. Personally, I've gone through that as well. And it takes a long time and it can suck. This doctor here, he's a neurologist. He works out of Stanford University in California. And he has two instances where a few people, his patients, needed to get care. They needed pretty intense surgery that had to be done on premises. Fortunately, in the end, these 3 cases were resolved and the patient got service. Unfortunately, though, it took months. So during this time where it can take months, patients, right, their prognosis can get worse. They can decline. They could potentially have died during the time when the insurance company had to make sort of the decision on whether or not you are going to get said care covered. And many of the times, I believe they quote quite a high number. I don't want to say something that's not true here. I guess they don't give you a number, but they say that many of the times that a prior authorization is required and an initial denial is given, this service would most likely be a routinely approved service, not something that's, incredibly insane like a spinal surgery or something. In addition, they found that 93% of physicians report that prior authorizations result in care delays, and 1/3 said that such delays could cause their patients to experience a serious problem, such as hospitalization, disability, and even death. So what it's basically saying is that many times this delay could cause more problems than it solves. One more thing. Physicians and their staffs usually have to spend 2 business days a week just dealing with prior authorizations and things of this nature. I myself have not experienced this firsthand, but secondhand. My wife is a provider. She works at a clinic, and in addition to patient care, charting the notes, replying to patients, making sure her credentialing is up to date, keeping up with the hospital's policies and their ever-changing medical legal landscape, also has to deal with prior authorizations, which physicians and their pay scale do not get compensated for. So if you can imagine, if you are a billing or if you're a doctor who has to see, let's call it 30 patients a day, you're allotted 15 minutes per patient. where's the time to do all the extra stuff that I talked about? Replying to patients, making sure that the results that are back from the lab are in good order, are even in the chart where they're supposed to be, making sure that your patient understands something that came in the mail about a recall of a medication, or something in the mail about a service being potentially denied. When do you have time to explain all of that? And most doctors, to be honest, do not know how to combat a denial before calling that particular insurance company, because each individual insurance company has all kinds of different loops and hoops to jump through to get things covered. So, fortunately, there are, I guess, certain things that are being covered. And I talked about this in a prior video about I think it's called the Seniors Timely Access to Care Act, which will expedite these kind of prior authorization services on a widespread level, where you have to kind of go through these prior authorizations, not by just simply sending in the request to your insurance company, but pre-filling out forms so you can electronically get these services approved instead of having to go through people. And if you have seen other videos that I've made, a lot of Medicare Advantage companies' resources funding is allocated toward prior authorization and claims, which is funny because that's the department that denies people insurance, but it does eat up a lot of the budget. Whereas on the original Medicare program, while the original Medicare program does not have these safeguards, the physician should be in a place where they understand that we're not trying to just break the bank here, right? We're trying to give adequate and responsible services to these clients, these patients, so that number one, they can be healthy, but number two, don't put them through all these extraneous services just so that you as the provider can make money. I'm sure most providers don't think that way, but the system is set up so that there's a safeguard, which is a Medicare Advantage company, which looks like is sucking out more money than they need. Now, let's take things all the way back to the restaurant. Okay, so the restaurant. We have the steak. We have the catfish, right? For me, depending on my mood, right? Usually, I'll be honest, what usually happens is I get the catfish, my wife gets the steak, and I eat some of the steak. So, for those of you, shocking ending, I didn't play by the rules. But if I did, this is what I equate it to. Okay, so we get the cheaper one, right? The catfish is cheaper. I think it's more efficient. Still get the same amount of meal. Still get the same amount of, volume. Still feel full after. We still feel pretty good. That to me is like Medicare Advantage, right? It's a little bit cheaper. It probably is even cheaper to produce, and probably the gross profit margin on that catfish is probably more than even the steak, because the steak's expensive. Like I'm buying a 24-ounce ribeye. I mean, I'm getting it for like $30. That's a great deal, because if it went to store, it'd be way more expensive. Catfish probably gross cost probably like $3 or something, where the gross cost, the cost of goods of my steak is probably half of what I'm paying for it. Probably $15 to pay for this whole plate, whereas my catfish this only costs $3. So I have a huge markup on the catfish, but I don't care because I'm saving money. Steak's so much more expensive, right? Why do I pay more for something that, But when you break it all down, you're actually getting a better deal off the steak, because, simply stated, you're not getting ripped off as much as on the catfish. But I myself always get the catfish because my wife gets steak and I like catfish. I don't want to go through the whole hassle of cooking it and battering it, frying it, and all that stuff. So I get it prepackaged, right? I could save more money by going and just buying the 8-ounce fillet of catfish at the store, getting some really inexpensive fish fry batter and then dipping in oil and frying it. Probably cost me $5, whereas the steak would have cost me like $20 to do at home, because of all the prep work and things that I would need to go through to get that 24-ounce steak, which is most likely going to be close to $20. That's kind of what it's like. Which one is right, which one is wrong? Heck, people go to the store, they go to the restaurant, and they buy the catfish all the time, right? They're happy with it. They like that choice. They understand the mechanics of the marketplace. And that's kind of what everyone has to do when they pick a Medicare plan. I'm not saying that the Medicare Advantage plan is junk. Not at all. What I'm saying is that the Medicare Advantage plan is different. Just like how the catfish is different from the steak when you order it at Texas Roadhouse. Price is different, satisfaction, your preferences are different. Heck, there's some people that will get the catfish all the time, even if they know, like me, that they are getting ripped off harder than they would if they got the steak. But I don't care, because convenience for me, right? I don't want to spend all the time doing all that work. They can do it all themselves. So, which one's the best for you? I don't know. But you have to just know what is going on and be informed, as I am, about these things. And don't take too much, I guess, don't weigh too much in the pros and cons that you read online. Because a lot of times, like I showed you here, the major con of the Medicare Advantage plan is not the fact that you can't go outside the network. I'll be honest. That's small beans in comparison to having your services denied. Having the services denied means that you don't get to get coverage at all. Nothing. But if you can, make the choice based on what you need. Some people can afford a Medicare supplement premium. And I will say this again and again, I said this before. Original Medicare's costs are scary. Therefore, I always suggest getting a Medicare supplement plan. Because I don't want anybody to go to the restaurant and look at the menu and starve. Okay? That's the option that I talked about a little earlier, but I said don't think about it because that's not. You can't starve. You can't choose a health. You can't not eat. You have to eat. You have to choose a health plan. But even if you choose a health plan, for example, with the original Medicare, you have to eat. So make sure you folks are cognitive that, or are aware that even though you can choose the original Medicare route, get all these no prior authorization, the costs are expensive. And I don't want you guys to go to the restaurant and not eat. Okay? So look at my videos, how I choose the Medicare supplement plans. Ask all the questions you need if you haven't already chosen one. And I'll see you guys in the next video.